Hi all of you, I'm Dr. Vijaykumar Bada, Senior Consultant and Clinical Director of Surgical Gastroenterology and Robotic Sciences at Yashoda Hospitals, High-Tech City, Hyderabad. Hemorrhoids, or what you commonly call as piles. It's a very common problem. We see a lot of patients day in and day out, but many patients have this shyness to not reveal that they have got hemorrhoids or piles. Yeah, it's a very common problem, and the most common presentation is bleeding while passing stools, and some of them have piles which protrudes outside of the rectum. This is happens more commonly in little elderly people, also in younger people who have got constipation and who have got faulty bowel habits, that people who spend a lot of time in the washroom putting extra pressure for evacuating the bowel. So these are some of the more common causes for having piles or hemorrhoids. Now the treatment of piles or hemorrhoids are definitely there, and it's a very good treatment options available now. Conventionally, this was done by open surgery, where the hemorrhoids would be cut and then stitched. That would result in a lot of pain and a longer recovery time. But of late, we have got a lot of modern advanced treatment options for piles. We call them the office procedures. That means for these procedures, you have to come in the morning, get the procedure under local or regional anesthesia, and then you can walk back home in the evening and get back to your work in very next day or maybe a couple of days. So there are many other office procedures, many procedures for piles in the of late. So one common of them is the laser, which you all of must have heard of. Laser is a very good treatment. It directly hits the hemorrhoids. What we do, hemorrhoids are piles, what you know is just a blood vessel which protrudes outside into the lumen of the rectum. So in laser, we pass laser beams and it hits directly the blood vessel which is protruding outside. It coagulates that and seals the vessel, so that there is no further blood supply into that prolapsed piles. So there the rest of the pile will regress and then it will fall off. So that is how the laser works. So laser is very precise because it goes directly and hits the blood vessel which is causing the hemorrhoids or piles, and it regresses very fast. There is very less pain and hardly you need any anesthesia. Most of the times we do this under local anesthesia. Some of them who are very sensitive, we do under regional anesthesia. And as I said, it's a daycare procedure, like you come in the morning and finish the procedure and get back in the evening. Apart from this, there are various other one or two other modern procedures, like the hemorrhoidal artery ligation by using a harmonic or a ligature artery ligations. Here, instead of what I said, the laser going and sealing of this vessel, we actually seal this vessel by using various energy sources and cut them. So the whole of the hemorrhoids will be vanishing very quickly. And more advanced procedures are the stapler hemorrhoidectomy. Stapler hemorrhoidectomy is in people who have got piles of a larger grade. There are grades of piles, like grade 1, 2, 3 and 4. In grade 2 and 3 who have got symptoms, bleeding, laser works very well. Any of the other daycare procedures work very well. If the piles are of higher grade and there is more bleeding, they have bigger piles, then stapler is one of the best procedure. This is also least painful, and it also comes under the office procedure types, where you can walk back home on the same day. There is also quick recovery for this one. So I think you must first be aware that piles can be there even without bleeding or without any symptoms. If you have something protruding out of the rectum when you are going to your washroom and it's not going back easily, or you have to push it inside, that means probably you are having got piles. Or if you are having blood in your stools, which you have noticed of late, why with pain or without pain, you should consult a doctor and find out what is your problem. There could be 2 to 3 other problems. You could have a fissure, or you could have a piles, or you could have both together. So first meet a doctor, find out what is your diagnosis. If it is piles, then check if you can be treated by laser, which is a very quick recovery procedure, and then get the procedure. It's very safe with almost zero complications and quick recovery. So consult your doctor when you think you have one of these problems, meet a surgical gastroenterologist and they will be able to tell you what best to do. Thank you.